Thank you for taking the time to sit with me today as we go through this presentation on Medicare. It's important to have the right information so that you can make an informed decision on planning for your health coverage for the rest of your life. If you are within 3 months of turning 65, or you are eligible for Medicare initial enrollment period or a special enrollment period, then now is a good time to start researching your options for Medicare. My name is Jackie Walter, and I'm a Medicare insurance advisor and owner of Translating Insurance. I'm an independent broker, so I work with all the plans in the market to help you make the right choice for you instead of trying to fit you into a plan if I only worked for that one plan that might not be the right fit for you. So my job is to educate you, to inform you what Medicare covers and what Medicare doesn't cover, so that you can pick the appropriate supplementation for your lifestyle. So we're going to go through some information about Medicare and help you choose your coverage with knowledge and confidence. Today we're going to cover eligibility, Medicare basics, your Medicare options, the costs associated with those choices, and then some important dates to remember. What is Medicare? Medicare is a U.S. government's largest health insurance program. It is a federally funded program, and it's directed by the Centers for Medicare and Medicaid Services. Medicare has 4 parts. Part A and B are original Medicare. Part C is what is called a Medicare Advantage plan. And then you have Part D, which is your prescription drug coverage. Now, eligibility for Medicare is dependent on a few things. 1, you need to be age 65 or older to be eligible for original Medicare. Also, certain people under the age of 65 are eligible based on disability. Additionally, people with end-stage renal disease are eligible for Medicare. And also, you do need to be a resident of the United States for at least 5 years. What does Medicare cover? Well, original Medicare, which is offered by the federal government, covers much, but not all of your care. There are deductibles and coinsurance associated with original Medicare. Part A helps cover your hospital stays, skilled nursing facility stays, hospice care, home health. Now, I want to clarify that skilled nursing facility stays are short duration stays. Part A and Part B of Medicare do not cover long-term care. So if you are expecting something to cover you in a long-term care facility, you would need to get separate insurance for that, as Medicare will not cover that. This is just short rehab stays in a skilled nursing facility after you've been in the hospital. Part B is your outpatient coverage. That's going to help cover doctor's visits, outpatient care like labs, x-rays, diagnostic tests and exams, preventive services, occupational and physical therapy, as well as chemo, radiation. That is all lumped under Part B. Even the emergency room, urgent care, and ambulance would all be covered under Part B. Medicare Part C is actually an Advantage plan. So Medicare Advantage plans are offered through private insurance companies, and they do have to cover at least what original Medicare covers, but it's all done through private insurance companies. So your claims and your billing and your care all comes from that private insurance company. Medicare Advantage plans also may include additional services that original Medicare doesn't cover, like dental, vision, and a gym membership. Most Medicare Advantage plans also bundle prescription drug coverage into the plan so that you have creditable Part D prescription drug coverage. You could opt to get a standalone prescription drug plan instead, which is called Part D for drug. And Part D helps cover prescription drugs. Again, it may be included in a Medicare Advantage plan or it may be a standalone plan. Prescription drug coverage is required by Medicare If you don't have creditable drug coverage when you turn 65, you could incur a late enrollment penalty. Prescription drug coverage is offered by private insurance companies, but they are contracted with the federal government and have to offer minimum basic standards of coverage that are required by Medicare. Each Part D plan has its own list of covered drugs, so it's important to choose the one that includes the medicines that you take regularly. And there's two ways to obtain coverage, as we've discussed: a standalone insurance plan, or you can get your drug coverage as part of a Medicare Advantage plan that includes Part D. Now, how does prescription drug coverage work? Medicare Part D starts with a deductible phase. Your plan deductible can be up to $480 for drug coverage, and that resets January 1st each year. Then you fall into the initial coverage phase. Once you've met your deductible, then you're going to be in the copay phase. The initial coverage phase, where you pay copays based on your plan's details, it stops when you and your plan have paid up to $4,430 towards your medication. Once you reach that threshold, you enter something called the coverage gap, or the donut hole. You're going to switch over to paying 25% of the cost of brand name or generic drugs in the coverage gap, and the coverage gap lasts until your out-of-pocket reaches $7,050. Once you've exited the coverage phase, you'll enter what's called catastrophic coverage. In catastrophic coverage, you pay 5% of the cost of the drug, or $9.85 for brand name drugs, whichever is greater, or 5% of the cost of the drug, or $3.95 for generic drugs, whichever is greater. And that catastrophic coverage phase does not end until December 31st. Then everything resets January 1st and you go back to the deductible phase. So it's important to find the plan that covers your drugs for the least cost so that you can avoid the coverage gap. That's where brokers come in. Our job is to help you find the right plan for prescription drug coverage. Now, what is a Medicare supplement? These plans are often called Medigap coverage, and they work with original Medicare. They are designed to go behind original Medicare to pick up some of the costs that original Medicare doesn't pay, such as copays, coinsurance, and deductibles. Each Medicare supplement has a unique blend of benefits, and so Medicare beneficiaries definitely want to pick the type of plan that, covers the needs that they have. The nice thing about Medicare supplements is they give you a much more predictable expectation of your out-of-pocket healthcare costs. Because they pick up most of those copays, coinsurance, and deductibles, it's rare for someone with a Medicare supplement to experience unexpected medical expenses. In addition, Medicare supplements work anywhere in the country that original Medicare is accepted, so you're not limited to a network of providers. So you have several options when you're looking at supplementing Medicare. You could just stick with original Medicare. That's going to cost you $0 for Part A as long as you've paid into the system for 10 years. You will have a premium for Part B that's based on your income. And then you're going to have a large Part A deductible each time you're admitted to the hospital, and an annual Part B deductible, along with 20% coinsurance for all Part B care. You could purchase a standalone Part D drug plan behind original Medicare to help you purchase prescription drugs and avoid that late enrollment penalty. I don't recommend option 1 because that gives you unlimited financial exposure, as there's no max out of pocket on original Medicare. Option 2 is where you put that Medigap or Medicare supplement behind original Medicare. There is a monthly premium for that policy, but again, it gives you some stability as far as the premium goes and helps you supplement those deductibles and coinsurance so that you don't have surprise expenses. On option 2, you can still put a standalone prescription drug plan behind those two policies to make sure you have access to prescription drug coverage and avoid that late enrollment penalty. Option 3 is you get a Medicare Advantage plan, which again completely replaces original Medicare. However, you still have to keep paying your Part B premiums to Social Security for as long as you live. Those premiums do not go away, even if you choose a Medicare Advantage plan. You'll pay also an additional monthly plan premium if applicable. And then those Medicare Advantage plans, again, frequently include extra benefits and services like dental, vision, and hearing, and may also include a Part D drug plan to give you access to the prescription drugs that you need. There are some important dates to remember. First, that's not on this slide, is that your initial enrollment period starts 3 months before the month of your birthday. It includes the month of your birthday and then 3 months after. So you have a 7-month window to enroll in Original Medicare when you turn 65. Once you're on Medicare and you've chosen your Medicare supplement, you also have an annual election period that runs October 15th through December 7th, where you can enroll in a Medicare Advantage plan for the next calendar year, or you can change your standalone prescription drug plan for the next calendar year. Both would start January 1st of the next calendar year. There's also special enrollment periods with Medicare. The timing depends on the reason for your special enrollment period. So if you're moving and outside of your plan service area, you have an ability to enroll a new plan in your new service area. You may qualify for extra help because of low income, which gives you the ability to change plans mid-year based on your extra help status. Some people qualify for special needs plans, especially if you're dual eligible for Medicare and Medicaid. And also losing group coverage from an employer is also a special enrollment period. There is something else called the Medicare Advantage open enrollment period that runs January 1st through March 31st, where you can, if you're already enrolled in a Medicare Advantage plan, make a one-time choice to change to a different Medicare Advantage plan for the remainder of the year, or disenroll from your Medicare Advantage plan and go back to original Medicare with a prescription drug plan as a standalone drug plan. When you're making your Medicare choices, you do need to consider the following factors. First off, cost. Can you afford the premiums, the deductibles, the coinsurance, and the copayments for the plan that you're looking at? Or secondly, can you afford whatever financial exposure is going to be, upon you if you choose a plan that doesn't cover those things. You want to look at the benefits. Do you need coverage for hearing, vision, dental, and prescription drugs? How about the convenience? Are the network providers conveniently located? Are your providers in the network? Is your preferred hospital in the network with the plan? These are all very important things. Also, make sure your prescription drugs are covered by whatever plan that you choose. And you don't have to make these decisions alone. That's the job of your broker, is to help you navigate the system. Another thing is to think about your needs. Your health history. Do you have chronic conditions? Will your healthcare needs grow in the near future? How about your prescription drugs? Do you think your spending is going to increase in the future? Medicare Part D will help cover the costs of your prescription, so it's important to have a drug plan even if you're not taking any prescriptions right now, in addition to avoiding that late enrollment penalty. If you feel that you need more coverage than Medicare Part A and B, which again has no max out-of-pocket, a Medicare supplement insurance plan or a Medicare Advantage plan will help cover some of those unexpected healthcare costs. What is the difference between Medicare Advantage versus Original Medicare? Both must cover at least what Part A and Part B cover. Now, you may have to pay an additional monthly plan premium to have Medicare Advantage. You must continue to pay your Part B premium no matter how you supplement Original Medicare. Medicare Advantage plans may have additional benefits included, like dental and vision, that original Medicare does not cover, or they can be added at an additional premium. So what are the different types of Medicare Advantage plans? There are the HMO type plans. In most cases, in this situation, you have to stay in the plan's network or there is no coverage. And a primary care provider is assigned to you, or you can pick one in the network, and that person is your point person for your care in the program. There's also preferred provider organizations, or PPO plans. You can choose any provider that accepts Medicare, but you may pay less for in-network services. There's private fee-for-service options and special needs plans tailored for people who have chronic illnesses or are dual eligible for Medicare and Medicaid. Special needs plans offer benefits, specialized healthcare, and drug coverage designed to meet specific needs like chronic illnesses like diabetes or heart conditions, and there's some financial assistance with the program from the state. Medicare Advantage does have some extra benefits like those fitness programs, vision and dental coverage, access to mail delivery pharmacy, nurse advice lines, over-the-counter credits, and even some include transportation to medical appointments. So again, there are some helpful resources at Medicare.gov, but please utilize me as your broker to help find the right fit for you. Medicare is fun, so I hope you enjoyed this presentation and it gave you a clear picture of some of your options with Medicare.